Welcome to the presentation of the work How Avatar Customization Affects Fear in a Game-Based Digital Exposure Task for Social Anxiety by Martin Dechant, Max Birk, Youssef Shiban, Knut Schnell, and Regan Mandryk. Social anxiety, one of the most common mental illnesses worldwide, is characterized by an intense fear of being judged by others. To help individuals who experience social anxiety gain resilience against their fears, therapists use various digital exposure tasks to help patients gain resilience against stimuli that provoke fear. Digital exposure tasks are intended to provoke fear, but in a safe context that supports the individual to reframe the experience and develop strategies for resilience. To be effective, an exposure needs to ensure that the patient stays focused and engaged, and also needs to generate increased arousal and anxiety for the patient. Simulating the fear of being judged by others can be challenging in digital exposure tasks because patients may not actively feel judgment from a simulated audience or may feel that the situation is fake. However, game designers have overcome similar problems by offering customizable self-representations or avatars to the player. Prior work shows that avatar customization increases the enjoyment and spent time in a game because the customization helps players to identify themselves with their in-game representation. Furthermore, customized avatars have the potential to increase the momentary engagement and focus of the player towards the game and the feeling of acting of one's own volition. However, we don't know if these advantages are accessible to socially anxious players or will translate into a more effective exposure task. Early evidence indicates that players with social anxiety experience elevated fear when seeing themselves performing a task in a digital world compared to seeing someone else do so. So, does this mean that customizing an avatar can increase the experience of fear within a digital social exposure task? To gain a better understanding about this relationship, we conducted a web-based experiment. In our experiment, we asked participants to fulfill a gaming task. First, we either asked participants to create their own avatar, or we asked them to select a predefined one. After that, the digital social exposure task started. Participants had to approach a clerk in a virtual supermarket and buy toilet paper. Next to the checkout area stood two random agents and watched the performance of the player. After telling the clerk what they want to buy, participants had to solve a math-based problem in a short time. After entering their answer to the riddle, the two agents reacted negatively to the performance of the player. Before and after each trial, we asked participants to rate their expected and the experienced fear on a scale from 0, no fear, to 100, extremely high fear. We assessed the personal level of the social anxiety trait using the Leibowitz Social Anxiety Scale, or LSAS, prior to the task. Overall, the results of our work show that the participants expected and experienced social anxiety in our digital social exposure task depending on their level of trait social anxiety. However, the avatar customization affected the strength of both measurements. The strength of the prediction for the linear relationship between expected fear and trait social anxiety is higher when players customize their avatar. But the relationship between trait social anxiety and experienced fear was only significant when players customized their avatar. Additionally, our results suggest that customized avatars are more effective in maintaining fear within the task over multiple sessions than predefined avatars. Our findings can help designers of digital exposure tasks. Customizing the avatar may increase the experience of social anxiety in the game, which can improve the efficacy of the exposure. This can be helpful in two ways. For example, in the beginning of the exposure treatment, patients may explore social situations from a different perspective using a predefined avatar. Later in the exposure, Once they gained more resilience, they could even further increase their resilience using a customized self-representation. However, designers need to be aware of creating avatar customization interfaces that allow for individual representation, such as the selection of multiple genders, skin colors, ages, and other identity factors. In our work, we show that the effects of trait social anxiety on expected and experienced fear in a digital social exposure task are stronger when using customized avatars. Further, we show that customized avatars demonstrate potential to maintain fear over multiple exposures. We provide new insights about how avatar customization affects the experience of social anxiety, which helps designers of interventions to increase the efficacy of their digital implementations of exposure therapies. Thank you very much for watching.